All right, let's talk about something that can send any parent's heart into their throat, finding a sudden, weird little lump on your child's hand or wrist. We're going to dive into what are called ganglion cysts.
You know the moment. 1 minute, everything's fine, and the next, you're looking at this firm little bump that just appeared out of nowhere. And of course, your mind immediately starts racing.
Okay, so first things first, take a deep breath. You are absolutely not alone in this. Pediatric hand specialists see this all the time. And the big takeaway from years and years of research is that these things are almost always completely harmless.
So, to really get why you probably don't need to worry, we've got to understand what this little lump actually is. Let's unpack the basics. Okay, so here's the official kind of sciencey definition. It sounds like a mouthful, right? But the only words you really need to focus on are benign, which just means not cancerous, and mucin-filled. It's basically just a little sealed up sack of thick goo.
Yeah, the best way to picture it is like a tiny water balloon. It's connected by a little stalk to a joint or the tunnel that a tendon runs through. And it's filled with the body's natural joint lubricant that's just gotten really thick and jelly-like. That's it. And here's a perfect example. This is a super common spot for one, right on the back of the wrist. See how it's just a smooth, round little bump right there under the skin? That's your classic ganglion cyst.
Now this is maybe the most important part of this whole explainer. Ganglion cysts happen to adults for sure, but the ones we see in kids, they're a different breed. It's not just a smaller version of what an adult gets, they actually come from a different place and act differently.
Just look at the difference here. In adults, they're usually on the back of the wrist, coming from deep down in the joint. But as researchers like Dr. Satku and Dr. Thurkaned have pointed out, in kids, especially the little ones, under 10, they're actually more likely to be on the palm side, what we call volar, and they come from a tendon sheath, which is much closer to the surface.
And the numbers back this up completely. A big study found that for kids under 12, it's a bit of a coin flip, but more than half are on that palm side. That's the total opposite of what we see in the adult population.
So why does that matter? Well, it's everything. Think about it. A tendon sheath is supposed to be flexible and slide around. Since the cyst's little stalk is attached to that moving part, it has a much higher chance of just sealing itself off and disappearing. It's way easier than if it were attached to a big, deep joint.
And that brings us to the #1 most effective first step for these cysts in kids. It's going to sound wild, but the best thing to do is often nothing. And I don't mean ignore it, I mean an active, science-backed medical strategy called observation.
Just look at this number for a second. 44%. This isn't a guess, it's from a huge recent study, and it tells a really powerful story. That's right. In a study with over 650 kids, almost half of the cysts that weren't causing any problems just went away on their own. No shots, no splints, no surgery. This is solid proof that watching and waiting is a real treatment with a fantastic success rate.
And hey, this isn't some brand new idea. Doctors have known this for a while. Way back in 2001, researchers were saying the exact same thing. If it's not causing any problems, observation is a treatment with marked success. It's just smart medicine.
And listen to this. For parents with younger kids, the news is even better. That same huge 2022 study, it found that for kids under 10, the chance of it just disappearing on its own jumps to 53%, more than half. Time really can be the best medicine. Now, of course, observation isn't the magic bullet for every single kid. Sometimes these cysts can be a real nuisance that can be painful or get in the way of playing or writing. So it's important to know what the other options are and, what actually works. This chart is amazing because it just lays it all out. It shows the long-term success for each treatment. No surprise, surgery works the best, fixing the problem about 73% of the time. A splint is a little better than just waiting. But look all the way at the bottom. Aspiration. That's sticking a needle in it to drain it.
This is so important. At an 18% success rate, trying to drain the cyst with a needle is less than half as effective as just doing nothing. When you think about how unpleasant that procedure can be for a kid, the science is crystal clear. Aspiration is just not a good choice for these.
So when does a doctor start talking about surgery? Well, it's usually for a few specific reasons. 1, the cyst is actually causing significant pain. 2, it's physically getting in the way of them using their hand. Or 3, it's just been there forever and is causing some real emotional stress. That's when it's time to consider a more definitive fix. And here you can see what that looks like. On the left is a cyst that was causing problems, and on the right is the result after surgery. For those specific cases where the cyst just won't go away and is causing trouble, it's a really effective, clean solution.
Okay, that was a lot of information, I know. So let's boil it all down to the key things you need to remember. We want to take that initial flash of worry and turn it into real, informed confidence.
So here's the bottom line. Number 1, these things are common, they are harmless, and they are not the same as adult cysts. Number 2, they go away on their own all the time, especially in kids under 10. Number 3, because of that, just watching and waiting is the best scientifically proven first step if it's not causing problems. And finally, if it is a problem, surgery is a great option to have in your back pocket.
So I'll leave you with this question. Now that you know that these cysts in kids are different, and that time is one of the most powerful treatments we have, how does that change the way you'll talk about this with your doctor? You can walk into that appointment not with fear, but with knowledge, ready to ask the right questions and make the best, calmest decision for your child.